Welcome. It is now May 1st, 2024. I'm Dr. Deuk. Our patient travels here from Texas. He has a massive disc herniation at a very abnormal C4-C5, which you could see on the x-ray. We are now in the midline, and now show us the newest x-ray. Henry, the lateral view. We are lined up over the disc that needs to be repaired. He has a clipple file below and above what we're operating on. A clipple file is a congenital fusion of bones, and we are now advancing the dilator into the disc at C4-5, okay? It's a very unusual C4. It's actually, it looks like some type of a fusion between C3 and C4. And then you could see the bone below is kind of smaller. Yes, the vertebral body is smaller. And the herniation is right here where we are. Show us where the herniation is, the back of this disc, okay? So it's very unusual anatomy. You can actually see a cleavage point. Jordan, go back. Show us the middle of that abnormal vertebral body above. Right there, there's a dark spot right there. You see that dark line? That's where those two bones are fused together. So it's really a 2-3-4. It's a 3-4 fusion called a clipple file. And then he's fused again down below at C6-7. So he didn't have any of this fusion done by a man. It was done by, while he was developing in utero. All right, at this point we are in the right disc, and we're going to keep his blood pressure up so that we don't have any issues with the cord and perfusion. This is a very unusual case in that he's got myelopathy shot, which is spinal cord dysfunction. This is not a procedure being done for neck pain from the disc. This is for being done for damage to the spinal cord. He's already has damage to his spinal cord from this herniation. It's huge. Shot. 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 Interesting. Take that. There's a lot of scar tissue in this disc. Let me have the guide wire. Trying to get some dye into the disc. It won't leave the dilator. It means the disc is very abnormal. Shot. Shot. All right, so we cleaned out the dilator. Feel free to ask questions during our live stream. Shot. All right, there it is. You can see the dye. Show us the herniation there, Jordan. You guys see the blush of the dye that's gone through the disc, out the tear, and it's sitting there up against the spinal cord. Shot. Give me an AP view. Let's just double check the AP shot. Coker. Actually, I don't need a coker. It's staying. By the way, the whole surgery we're doing is endoscopic. It's done through a 4mm incision. And there's no damage to any of the structures underneath. And show us while you're there, just stay there for a moment. Show us the endotracheal tube. Yep. Show us the esophageal temperature probe. It's braided. There you go. So you got two lines there, and they're displaced to the side because I pushed them over to get down to the disc. This is anterior cervical endoscopic spine surgery, folks, done at Deuk Spine Institute. We've been doing it for 18 years. We've peer-reviewed and published. Everything we use is FDA approved. All right, now that we're in the disc and almost to the back, I'm going to bring in the dilator, the tubular retractor. The entire surgery will be done through this 4mm wide tube. Okay, it goes over the dilator, and that's why the skin incision is only 4mm. The whole thing is done through a little puncture. Now, other surgeons would recommend fusion, and we talked about doing fusion. The patient didn't want fusion. He came here not to get a fusion. He came here to get the endoscopic surgery. So fusion is always an option. I don't recommend it, but it is an option. All right, let's watch the tip of that dilator. See, it's already moving back. Shot. That means there's some pressure in the disc from inflammation. So you can see that dilator moving back. Shot. Yeah, there's a lot of pressure, actually. I'm surprised. I thought this was an older herniation, but it is older, but there's definitely a huge inflammatory component, meaning that there's a lot of inflammation going on right now in this disc. Shot? Now the herniation is off to the patient's left side, and so it's in the middle plus the left side at the back of the disc, and that's why we're starting on the right so we get across to the other side. If you have questions, feel free to ask them. In the meantime, Henry, let's show our viewers why do herniated discs actually cause neck pain. You can do that. Welcome back. So you can see now how a herniated disc can cause so much pain. It's through inflammation. Inflammation is your body's way of attacking and repairing, more so attacking and cleaning up things that it wants to get rid of, okay? So it's a defense system designed to destroy. It is not a reparation system. It's a destructive system. The inflammatory system is made up of cells and chemicals produced by your body called cytokines. And it's a defense system that is very old and very rudimentary, simple, not very sophisticated. Unfortunately, it can do a lot of what we call friendly fire. Let's turn the light down. It's way too bright. I need 2 clicks down, please. So the friendly fire means your inflammatory system is destroying your own body, okay? Rather than just foreign invaders like bacteria or viruses, okay? Or protozoans. So if your inflammatory system is not very specific about what it's attacking, which it's not, it just bombards an entire area. It's like a nuclear bomb going off, right? You all remember Hiroshima, Nagasaki. The bomb killed a lot of civilians, Japanese civilians. You know, it was a horrible situation, and we wish it didn't kill so many women and children and you know, people that weren't involved in the war, basically. It wasn't very strategic. Now we have more strategic weapons, right? So, but back in, you know, World War II, we didn't. We had this big explosive device that just created a lot of destruction that was out of our control. We just could control where we dropped it, but from there, it just did a lot of damage to things maybe we didn't want to damage, okay? I mean, there's always talk about how we use the nuclear warhead to basically take away Japan as a country, take away their desire to fight, which it worked, of course. There's a psychological component, but there were many lives lost and so much destruction. And it's just very sad. Point is, The inflammatory system is like a nuclear bomb. Once you set it off in an area, it just goes crazy. And it's not just one bomb, it's many. And it doesn't stop. It doesn't stop until the foreign invader is gone. Now the problem is, there really is no foreign invader when you have a disc herniation. It's just a herniated disc, and the foreign invader is the nucleus pulposus. It's a jelly that it's really part of your own body, but your inflammatory system doesn't see it that way. It sees it as a foreign invader, and it attacks it. And it's going to keep attacking until it's gone. The problem is, your inflammatory system cannot get rid of it. It's not capable of getting rid of it. So you have a situation where your inflammatory system has been triggered to attack, but the stop signal is not possible. The end signal is not there. It'll never come. Does that make sense? So your body just keeps attacking and attacking and attacking and attacking. And the pain and destruction at the back of the disc just keep happening. Like, look at this disc here. There's so much destruction. And the kind of destruction we see is all the things we see with degenerative disc disease. Bone spurs, calcium deposits, scar tissue, end plate changes, modic changes in the vertebral body end plates. These are all pieces of herniation here. That's a nice big piece. So the point is, it's just like if you were to attack a city. Like look at Russia. They attacked, Kiev, and the city is being destroyed by the artillery, by the bombs, by the rockets. And so you have a situation where there's just ongoing destruction every day that would never stops, right? And your body has an unlimited inflammatory system. There's an unlimited amount of destructive capacity or capability. There's no end. You can keep making more bombs, keep destroying. Does that make sense? So the amount of destruction that happens, the amount of pain and suffering that happens at the back of a disc that's injured it's basically, there's no end to it. It just keeps going. It's just so annoying. All right, Henry, let's show these people the solution to a herniated disc and all the suffering and pain. All right, so you can see from our video how this procedure actually gets rid of the herniation at the back of the disc where all the symptoms come from. Plus it can clean the tear that is wide open, letting pieces of herniation come out. And that tear will continue to release herniations non-stop with every little movement and activity the patient does, whether they pick up a book or something light, and it'll keep herniating. That's the problem. So we want this tear in the back of the disc to basically seal itself off so that no more herniation will come out. What you guys up to over there? All right.
You okay, Kurt? Your knees?
Getting a workout in? So guys, take a look at this that I'm working on. This is extremely calcified and scarred. This part of the herniation has been here for many years, probably 10, 15 years. So if I had to say this injury in this particular patient is probably 30 or 40 years old, okay? And of course the laser is a wonderful tool because you can control the laser so that you're only removing very small amounts of the herniation, okay, at a time. So it's very precise.
The way that you're moving your camera almost makes it look like that's a marble.
A marble?
Yeah. Just so hard.
It is hard. What I'm removing right now is hard as a rock. That's all extremely calcified herniation, scarred up.
I'm just saying by the way you're moving your camera it makes it look like it's moving inside. Not just moving the camera.
Yeah,
Audience can't see that.
sure. Yeah, Dr. Davis is saying that the effect of this camera being moving and the way that it is seen and perceived, maybe you might think that there's movement going on inside rather than the camera moving, but we're moving a tube. So I'm able to move this tube left and right, up and down a little bit, mostly left and right, to remove pieces of herniation. And you can see the herniation floats up towards us and out. That's how we get rid of it. I need probably 15 minutes more. Now, one thing a lot of people have a hard time understanding is we cannot remove 100% of the herniation. It's not possible. There's no human being that, or doctor or surgeon that can get rid of 100%. There's always going to be some residual amount of herniation left. And that's because there's parts that are underneath the bone edge, there's parts that are stuck to the spinal cord, and you cannot remove that. Look at that big piece of herniation that just came out. Literally sitting on top of the spinal cord. That was about a 6 millimeter piece. Come on. This is all herniation right here, pushing on the spinal cord. Oh, there's another piece, just came out. See that? Pretty cool, guys, huh?
Yes, we do.
Amazing. So because this patient traveled from Texas to Florida for this procedure, he did not want fusion, and we're not going to do a fusion on him. He's going to be able to get this treated without fusion. That's what he wanted. He didn't want fusion. Everybody else offers fusions or artificial discs, basically metal. Who wants a piece of metal in their neck? I mean, those metal discs have so many problems. Another piece of herniation. I have to cut this with the laser because it's too big. It won't come out on its own. Remember, the tube is 4 millimeters external diameter, but the internal diameter is around 2.8 millimeters. So, come on, guys. We don't need those kind of noises in the operating room. Let's be a little more careful. Anyway. Any questions, Henry?
At this moment, no current questions.
What do you think, Luis? Oh, another piece. Yeah, you see that? See, these are fragments. By the way, a lot of people think herniation is one event, one piece. It's not. It's multiple pieces over multiple events, multiple years. And this piece right here in particular, I don't know how old it is, but it's not a recent piece. It's been in there for a while. I can tell by the shape. But here you go. Yeah. Can you guys see this, Henry?
Yes, we can.
Yeah. So it's not a huge piece. It's about 5 millimeters. See that? That's what a piece of herniated disc looks like. The problem is there's 30 of them in there, packed in. This patient has been herniating for years. So my job is to go in and remove as many of those chunks as I can safely remove. The key is safe, okay? We as surgeons really want to not hurt the patient. That's our goal. We want to try to do everything safely. So, of course, you can unsafely remove 100% of the herniation. We don't want to do that. Unsafely means there's going to be a bad complication. I don't like complications. As a surgeon, for my patients, I don't want any complications. The complication rate for the alternative surgery ACDF is 50%. That means I've done now 1,000 of these surgeries. My complication rate, if it was the same as ACDF, would be 50%. So I'd have 500 complications on this cervical procedure. We've had 0. So what does that tell you about the safety of this particular procedure? Is massive. Much better than fusion. Okay? Fusion complication rate is very high, 50%. It's a known accepted complication rate. So this is a much safer surgery. We've had 0 complications to date. All right, a lot of scar tissue there. You can see it. Still herniation right there. And by the way, people talk about laser. Surgeons don't recommend it. The reason they don't recommend it is they don't have a laser. Therefore, they can't do laser surgery. They've not been trained on laser surgery. They can't do laser surgery. So for a surgeon to be able to do a surgery, they have to first be trained on that surgery. And they have to have the equipment available, the training available. Unfortunately, surgeons these days get paid highest for doing fusions. So they don't want to do non-fusion surgery. They want to make the big money. So a lot of times they'll recommend a non-fusion surgery just to make sure the patient will get a fusion later on, like a laminectomy, for example. Very common recommended treatment. Unfortunately, if you get a laminectomy, you're basically almost guaranteed you're going to need a fusion down the road. So a lot of surgeons will recommend laminectomy so they can get the fusion down the road. It's kind of like planting a seed for a tree and then waiting a few years and knowing you're going to have fruit. A fruit tree, right? Unfortunately, I don't see that as being very good from a patient standpoint. Why would you want to have a procedure that is going to make it more likely you're going to have another procedure? Okay? To me, that doesn't make sense. It's not good medicine. I don't know. I'm a little different. I like to fix things the right way the first time and not create a need for additional treatment for a patient. That said, some of our patients do have more than one problem that needs to be addressed, so we have to address it. Just about done here. Probably another 5 minutes to go. Dr. Berndes, are you guys doing all right? Now, I could be surprised, of course, you never know. But right now, what I'm seeing, another 5 minutes. Any questions?
Yes, we have a question from Samir on YouTube
Well, Samir, welcome.
asking, Doc, why can't we use the same 4 mm scope for lumbar for less incision and less damage?
Yeah. Great question, Samir. The answer is the lumbar discs are about 5 times, well, maybe even 10 times bigger than the cervical. So the cervical scope is for small discs. The lumbar scope is for discs that are 10 times bigger. And the reason for that is, remember, your neck just has to hold the weight of your head and your shoulders, right? But your lower back has to hold the weight of your head and shoulders and everything else, all your intestines and your entire, everything from your belly button up has to be supported by the lumbar disc. So lumbar discs are much bigger. So you need a bigger scope.
Actually, good question.
It's a great question. Yeah. Yep. Well, that's a bone spur right there. Those are bone spurs, by the way, right in the foramen. I always talk about how we don't need to remove bone spurs most of the time. Okay? This one we do, because it's right where the nerve is. So again, it goes back to my philosophy of treatment, which is do the least amount you need to do to fix the problem properly. And most of the time you do not need to remove bone spurs, but sometimes you do. All right, great question, Samir. Any other questions from our audience?
At this moment, no current questions.
This is the last of the herniation in the foramen right here, and it is deep in the foramen. Right there. You can see. Oh, by the way, the laser, as I was saying, can peel away 1/20th of a millimeter at a time. 1/20th. What surgical instrument, Dr. Davis, you're an orthopedic surgeon, what surgical instrument do you have that's not laser or endoscopic that can peel away 1/20th of a millimeter? None. Nothing. Nothing. Yeah. The point is, this is the most precise instrument in all of medicine. There's nothing more precise. Not even radiosurgery, radiation surgery, none of it is as precise as what we are doing right now. This is the most precise tool, the most precise setup. And by the way, you can't do laser this precise without the scope. So a high definition endoscope is required. So it's not just laser surgery we're doing endoscopic laser surgery. And it makes a difference. Laser by itself, you wouldn't be able to do precise work like this. You wouldn't see it. Must have a scope. So this is endoscopic laser surgery. And this procedure you're watching in particular is the Deuk laser disc repair. I need about 3 minutes. Any other questions?
At this moment, no current questions.
All right, I'm going to clean this edges up and we'll be done. We've gotten rid of most of the herniation. There's still a few pieces attached here. Let me see, Berndes, I think 3 to 5 minutes. Some of these pieces that I'm cleaning up are very dense. They just don't want to come out. So I'm going to have to break them up into smaller pieces. Our next surgery, by the way, if you're going to stick around, is a patient from where?
Where's the next one? Next patient. Where's the
Is he California? No. Is Seattle? Huh? Boston? Where is he from? Huh? We're not sure. Well, he's in the waiting room. I mean, in the pre-op. And he's a lumbar. And we're going to be doing 3 procedures. We're going to do a right L4-5 Deuk laser disc repair for a bad disc. We're going to do a right SI joint because he has really bad sacroiliac joint pain. And we're going to do a right piriformis release. And we did a piriformis release yesterday. Patient did fantastic. We have another piriformis release tomorrow, which I don't know if we're going to broadcast. If Davis wants to, you can. No? Dr. Davis is kind of a cursor. He yells and screams as he's operating. Huh?
They call him the old yeller.
You know, let me just check this out here. Old Yeller?
Old yeller.
That's a great book, by the way. One of my favorite of all time.
A lot of our audience
Look at that.
understand that.
Yeah. Old Yeller is a book. One of the greatest stories ever written. So incredible. Go read it. Old Yeller. My gosh, look at that hole right there. And I gotta go and look and see if there's any herniation down there. It looks like there is, Dr. B. That's gonna add a little time. Okay? Dr. Berndes? I just found a pocket of herniation that it's super scarred up. Fascinating. Look at that. Huh? All right. That's fine. Propofol them up if you can. Sorry. I just found this. It's like discovering something right before you're done exploring. Interesting. Yeah. That's where those herniations were, folks. I still only need a couple of minutes, but I do have to explore this cavity. Oh yeah, look at that. I think this is all herniation right here. Holy moly. Very old, look at that. It is herniation. Henry, you see this?
Yes, we do.
Oh, look how old it is. This is completely old and scarred in. Man. I need about 3 minutes. We should be done. You okay with that, Berndes?
Almost like you're taking the outside of an eggshell off.
It is. Yeah, you're literally taking it at half a millimeter maybe at a time. The nice thing is I can actually use the fiber to poke a little bit, you know? Yeah, please do. You know, the fiber is great for getting in there. You can poke a little. Holy mackerel. Huh?
Looks like there's a big one behind it.
Luis,
Yes, sir?
watch the tube. You mean this right here?
I'm saying once you get through the eggshell, it almost looks like there's more herniation in there.
There is. God damn it. We are in the foramen. Wow. This thing was hidden deep. That's amazing. This is an incredible deep pocket of herniation. All right, Berndes, I need a minute and I'm done. I've gotten rid of as much as I can safely do. God, look at all these pieces. Wait, don't touch. Don't touch. Don't touch. I got it. God. Yeah, this is a bad one. Well, he's here with his lovely family from Texas. I forgot where in Texas. Anybody remember?
Spring, Texas.
Spring?
Spring, Texas.
S-P-R-I-N-G. Near Houston. Okay, just about done. Another minute and we're done. Just want to look one more time. All right, that's where the herniation was. I've gotten probably 60% of it. And that's really good. It's gotten the pressure off the spinal cord and nerve, and that's going to help him tremendously. It's not 100%, but it's really good, considering there is no such thing as 100%. Any other questions?
No current questions, so we do have a comment from WD on YouTube.
Yep.
Just saying good morning from Keystone Heights.
Morning. Morning, morning, morning. All right. That's it. Where is Keystone Heights, by the way? Luis, you ready? That's the nerve right there, guys. That's the nerve. So we got all the herniation out of the foramen. That is awesome. I'm very happy about that. Peeled it off the spinal cord as well. There is a little bit left here, but like I said, we've gotten over 60%. That should give him great relief.
Sitting on, please. Thank you.
Any questions?
No current questions, but we I just looked up. Keystone Heights is between Gainesville and St. Augustine.
Oh, okay. I thought that was Palatka. I guess they're probably north of Palatka. I love St. Augustine. It's a pretty city. If you guys have never been to St. Augustine, I recommend it. Everything okay? Huh? Like what kind of trouble? You're not getting a reading because of his arm. Huh? All right, but good. Yeah. All right. I'm going to come talk to our audience. So let's go ahead and show them one of our patients. Let me show you the incision first. Basically, bloodless surgery. There's your incision, 4 millimeters. Okay? I'm coming to answer any questions. So go ahead and type your questions up for me. Thank you, everybody. Good job. Dr. B, I'm sorry he was challenging, but I feel good. Huh? What? Scope use is a 6. Henry, you going to show us one of our videos?
Of course.
Thanks.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-C5. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that it was really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with one day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. That's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiezan a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.
All right. Well, I hope you enjoyed that testimonial from one of our patients. This patient we just completed had a really bad herniated disc with calcification, scar tissue, real thick, fibrotic, pushing on his spinal cord and the nerve on the left side. And that was at the number C4-C5. We went through the front, and instead of putting a metal plate in and an artificial disc, we left his normal disc there, which was fine, and we went to the back of the disc herniation where the herniation was. So we went through the front of the disc, and we got to the back where the herniation was, and I used a laser and an endoscope to clean it out. It was pretty big. And there were probably about 30 pieces of herniation here. We got at least 60% of it out. I could see the nerve was decompressed on the left side. I could see the dura, the white stuff around the nerve. It's amazing. Even with all that grunge and yellow and calcium and bone spurs, when you're done, you could actually see the nerve root that goes down his arm, and that would be the number C5 nerve root. So that's what is responsible for lifting your shoulder. So this gentleman came from Texas, and he was only offered a fusion, which would have been what I would have done myself had I not known how to do the endoscopic surgery. Thank God I learned how to do the endoscopic surgery, and I've been doing it now here at Deuk Spine for 18 years. So Deuk Spine Institute offers a better option than fusions and artificial discs. Less invasive, more successful, faster recovery, safer, and yeah, that's what we just finished. So the whole incision is 4 millimeters. He's going to go home in an hour. He's going to wake up, recover, and then go. He cannot drive today, but he can be a passenger. He's going to go stay in a hotel with his family and enjoy his afternoon. Probably go for a walk on the beach, I hope, and have a nice dinner here, and then he'll be checked out in the morning. He'll fly back to Texas tomorrow. So basically for 3 days, we could change your life. All right, what question or comment do we have?
Just one comment coming from Scotty on YouTube, just saying, Doc, we need you in Charlotte, North Carolina.
Yeah, Scotty, thank you. You know, Scotty, Charlotte's not too far away, and we do take patients from Charlotte, believe it or not. So if you can make it down here, I would love to have you here and take care of you. But before you do, my advice is do an MRI review, which you may or may not have already done, and I'll tell you exactly what's wrong and what needs to be done to fix it over Zoom. Of course, we do have patients that come here and we get surprised they have another cause of pain we didn't see on Zoom, because really diagnosing pain is more, it's not about the MRI. MRI will never tell you where pain comes from. It's about the body, touching the body, localizing the pain, like about the pain map. And the good news is we know at Deuk Spine where all the pain sources are, and we know how to project them to the surface of your body. So it's a projected pain map, and that's what is half of our magic sauce, half. There's really two cornerstones, actually three. There's the diagnostic ability at Deuk Spine, there's the Deuk laser disc repair for disc issues, and there's the Deuk plasma rhizotomy for everything else. All right, well, thanks for joining us. Henry did a great job, and it's good to be back in the saddle, good to be back at work, fixing people and helping them have a better quality of life. We will be back here in 30 minutes with our lumbar Deuk laser disc repair. And this patient has a lumbar DLDR plus a SI joint DPR plus a piriformis release. Yes, we have a question.
Yes, we just got a question coming
All
from
right,
Ping.
we like questions.
Yes, we do. Coming from Ping on Facebook, asking, what's the most, oh, and another question, what's the most cause of neuropathy in the deltoids? Cubital tunnel or disc bulges in the neck?
So, yeah, Ping, you've got to get your wording proper, okay? You've been here for a couple of days, and it's time for you to learn. Neuropathy is the wrong word. It's used improperly everywhere, and you have to stop using it improperly. Neuropathy is a dysfunction of a nerve that comes from an internal problem. And the most common cause of neuropathy is diabetic neuropathy. You're talking about compressive neuropathy, and that's another name for that is called radiculopathy, or if it's just pain, a lot of times it's called radiculitis. So if you're asking what's more common cause of deltoid weakness, it's always going to be a pinched nerve in the spine, a herniated disc, usually C4-5, C5-6, usually C4-5. But there's other things that cause weakness in your shoulder. One of them is shoulder pain, or rotator cuff injury is another one. But ulnar neuropathy, cubital neuropathy, never causes deltoid weakness, ever. So that is not even a cause.
And then lastly, your next question coming from Chris on YouTube, asking, what's your advice on a herniated disc that cause nerve pain resulting in a temporary loss of legs?
Whoa. Temporary loss of legs.
Yeah.
So that concerns me. First of all, Most herniated discs in the lower back pinch a nerve that goes to one leg, not both. So the fact that you've got two legs affected, you either have a broad-based disc herniation with bilateral stenosis, or you have a thoracic disc herniation, which could cause you to be paralyzed, which is more serious. Either way, you need surgery. That's what I would do. I would not wait to become paralyzed before I get surgery. It's too late then. You've waited too long, you're probably not going to be able to walk again. My advice is fix it now. Come to Deuk Spine. Let us fix it for you the right way.
And that is it.
Have a great day. We'll be back in 30 minutes. Thanks.